You might probably think that red eye or eye injuries are the most dangerous eye emergencies. What if I told you that there are 7 silent dangerous eye signs that can lead to blindness if ignored? And sadly, these are what most people don't know. Some of these signs can either lead to total blindness within a few minutes if not taken seriously. So if you really want to save your vision, make sure you watch this video till the end, because the last 3 signs are what most people ignore and they regret it later. Hi, I'm Dr. Harun, and Optometry is here to help you care for your eyes and protect your vision for life. So if you are new to this channel, feel free to subscribe so that you don't miss out to future videos that may help protect your eyes. Let's get into the video. First dangerous sign is sudden loss of vision. So one man shared a story to me of how his sister woke up and can't see anything. She has no pain, no eye injury, she just woke up and couldn't see anything. That is what is known as sudden loss of vision. It usually happens when the blood vessels, that is the arteries and the veins supplying blood to your eyes, get blocked, thus preventing sufficient blood from reaching your eyes and leading to loss of vision. I'll honestly advise you don't joke with this case, because if care is not taken within 70 to 90 minutes, the person can go blind permanently. So it's better to rush the patient to an eye doctor immediately to save his vision. Loss of peripheral vision. Do you sometimes find yourself bumping into objects as you run, or just can't see something clearly by the side of your eyes? That is a potential sign for glaucoma, and it is called loss of peripheral vision. It means that you can see clearly something that is at the center of your vision right in front of you, but anything by the side of your eyes, you can't see it clearly. This is a very dangerous sign because it is progressive. Meanwhile, if you don't get tested early and managed properly, you will continue to lose the rest of your vision, and yes, even the central one, until it leads to complete iridosis. Don't play with severe eye pain, whether you experience it in the eye, that is what you call deep-seated pain, or just around the eye. And that can be a sign for many eye diseases that are considered as emergencies, such as optic neuritis, corneal ulcer, or even a serious type of glaucoma called acute angular glaucoma, especially if in addition to the pain, you also experience a headache, redness, blurry vision, or even nausea. These are symptoms that can confirm that, of course, you may have glaucoma. And therefore, when you look to see an eye doctor, you will get it. Eye injuries. This seems obvious. Yes, eye injuries are considered as emergency injuries. But here's the problem. Many people delay care thinking that it's just a minor, or just ignore it after first aid, whether it is done correctly or not. I once met a young man. He was working at diner in Destiny, who shared a painful lesson with me. One day, while on the job, a chemical splashed into his eyes. But instead of rinsing it out immediately, he delayed because he didn't want to mess up the clothes he was working on. Unfortunately, that delay cost him a lot because he ended up with corneal opacity that permanently affects his vision. So don't joke with eye injuries, whether from chemicals, sharp objects, or blunt trauma. Even if you feel safe after the pursuit, it's always best to visit an eye doctor to confirm you that you are safe. So these last 3 signs are what most people ignore. So I put them in a triad like this: sensitivity to light, red eye with discharge, and sudden appearance of floaters. Sensitivity to light or photophobia, as we usually call it, is not usually a complaint on its own, but the patients often complain it along with other eye symptoms. So therefore, there are many eye conditions that comes with photophobia. Some of them are very dangerous. So therefore, you need to go and see an eye doctor, because sensitivity to light can indicate that there can be inflammation inside your, such as uveitis. It can be that there is corneal damage or even eye infections. Red eye with discharge. This seems common, but here is the problem. Let me debunk the common myth. Not all red eyes are conjunctivitis or pink eye. Therefore, their treatment is not always the same. There are different causes of red eye. It can be caused by conjunctivitis, of course, but it can also be caused by keratitis or uveitis or it being eye injuries or underlying issue with your eyes. So therefore, the treatment cannot always be the same. So be careful with the red eyes. Whenever you have red eyes, it's always best to visit an eye doctor to confirm you with the cause and give you a proper treatment. Blotters are cobweb-like structure in your vision, or some patients report seeing a tiny threads in their vision. If you see that, that is an indication that there was a problem at the back of your eyes. Usually, if in addition to the clutters, you also experience flashes of light, as that can indicate that you may have an eye disease that is considered as an emergency called retinal detachment or retinal tear, or even posterior gyrus detachment, which is an urgent help. If you got value in this video, make sure you subscribe to the channel so that you don't miss out future videos that help protect your eyes. See you next.